Hello, and a very happy Sunday afternoon to you. Thank you so much for joining this very impromptu LinkedIn Live discussion about what is a breaking news story. This afternoon, Bethany Minelli of Sky News posted an article with the headline, which which spoke about doctors' warning of horrific impacts of tech and devices on children and young people's health. So I really do appreciate you spending some of your afternoon on this video and contributing to the discussion about what is a critical and emerging public health issue. And also, it's probably something that worries many parents. So please do add your thoughts and comments, and I'll do my best to add them to the lower thirds of the conversation as the discussion progresses. Just while we're waiting for people to join, I thought it also might be worth briefly introducing myself, but also thanking you. If you're new to the page, thank you so much for following. I really appreciate it. I'm a doctor and a dyslexic and a digital innovator, and I have a couple of roles that are relevant for this discussion. I'm an honorary lecturer at Hull York Medical School, having completed my doctoral studies in social media and mainstream media and COVID. So you can see why this story really sparked my interest. I also lead video and multimedia content strategy globally at Bayer. So with all that out of the way, let's jump straight into it and go through the article. So with a bit like you can see that on the screen now. And then, hold on, there we go. So doctors warn of horrific impact of tech and devices on children and young people. So it's quite a shocking headline for some, I guess, but it's important to put it in context as well. So the Academy of Medical Royal Colleges says it wants to highlight the risk of unrestricted content and screen time to children and young people. And this is a great example of how innovation can go rocket speed. So social media has been a very new and quick addition, but then the regulation of that is only kicking in 10 to 15 years later. So doctors are warning and medical experts are warning of growing evidence of health harms from tech and devices on children and young people in the UK. And the Academy of Medical Royal Colleges have said that frontline clinicians have given personal testimony about horrific cases they have treated in both primary, secondary, and community settings throughout the NHS and across most medical specialties. So that really does indicate this is a widespread issue and one that touches all parts of our health service. So it really does affect people in multiple different ways. That's important. And the reason why this body is quite useful is because it represents a coming together of 23 medical royal colleges and faculties who plan to gather evidence to establish the issues healthcare professionals and specialists are seeing repeatedly that may be attributed to tech and devices. So it intends to highlight the sometimes hidden risks of unrestricted content and screen time and young people, and provide guidance to the medical profession and, by extension, members of the public when the mainstream media pick up on this, about how to identify and manage the harm being done. And the Academy said it already has evidence on the impact on children and young people's both physical and mental health from excessive screen time, as well as exposure to harmful online content. It says the work is due to be completed within 3 months. And from my perspective, it can't be quick enough. And it's something that should have happened probably a long time ago, but it's super important that it's actually happening now. Chief Executive of the National Institute for Health Research, Lucy Chappell, and the UK government's Chief Medical Advisor, Sir Chris Whitty, were also sent a copy. And the chair of the Academy, Dr. Jeanette Dixon, telling the Sunday Times, without doubt, we are seeing the beginning of a public health emergency with our own eyes. Everywhere we look, we see children and adults glued to their screens. She goes on to say she really worries for children, some of whom are self-evidently imprisoned in a digital bubble. And recent government research has even linked this to screen time being as a result of leading to poor speech development in under fives. And this is particularly timely given the government prepares to announce to restrict the use of social media for under 16s, and a consultation is expected to be launched this week. I'm really glad a consultation is being launched, because I just had a conversation about this today, really, in terms of if we ban it, and social media is ubiquitous in the world now, but if we ban it completely, are we preparing children for the world and the real world, and also the world with generative AI laid on top of it? So the options being discussed will range from a full ban to limited interventions, including time restrictions and tighter algorithmic controls. And you may well have seen in the news, other countries such as Australia introduced a ban on under 16s having social media accounts, and many other countries around the world, including France, Denmark, Norway, and Malaysia, are now considering similar bans. So here's the counterpart of that argument, as I alluded to. Some children's and online safety organisations say a blanket ban is not the right way forward. And a joint statement signed by 43 child protection charities and online safety groups, including the NSPCC and Molly Rose Foundation, warned of serious unintended consequences that could put children at greater risk. So I'll put the link in the comments and let you look at the full article. This is clearly a story that is going to have legs. This is clearly something that's going to be super important in the age of generative AI, and as social media only becomes more and more used. And it's also something that Natasha Hanski and Vernon Baton and I are going to be discussing at the next medical festival in Brussels on the 29th of January. So if you'd like to get involved in the conversation, either put something in the comments below, or we will see you perhaps at Brussels. Thanks so much for watching, and hopefully hear from you soon.